Hello everyone. I just hope all of you are doing good and all of you are well. So today I'm going to talk about the difference between the MDMS and DNB. So first of all, I'm going to give you the overview of the things which I'm going to talk today. So the first thing it is the whether it is equivalent or not. Then what is the duration of these two courses? What are the fee structures, stipend? What's the academics, exit exam, and passing percentage? And also I'm going to talk about the terms and condition which are provided by the government of India, that where the MDMS degrees they are equivalent to DNB and where they are not. Also, in the end, I'm going to talk about which branches they are good in the DNB. So you get it. In case you are looking for the good branches, and also in the last, I'm going to talk about the that whether to opt for the MDMS and go with any of the branch which you are getting, or you should opt for the DNB with your choice of branch. Okay, so let's get started. So the first thing is that both MDMS and DNB both are the degrees. Many people, they are having perception in their mind that DNB is a diploma, but it's not. It is a degree, and it is recognized by the MCI, which is the Medical Council of India. So another thing is that what is the duration of these courses? So both these courses, that is MDMS or DNB, these are of 3 years. Both are of 3 years. So the another thing I'm going to talk about is the stipend. So the stipend for the MD and MS is they are having a better stipend than the DNB courses. So if you are getting a admission in the MDMS in the government colleges, so the fee structure is obviously less than that of the DNB, because the DNB and they are run in the corporate hospitals as well as the government hospitals. Okay, so then again we come to the academics. So the MDMS is usually done in the government hospitals, which are in the attachment with the medical colleges. So or even whether if it is a private college, but it is an attachment with the medical college. So for the MDMS, they are having a good teaching faculty and professors and all, but as compared to DNB, they are usually done in the private hospitals. So over there their focus is more over on the consultations and all. So there the so in the DNB colleges, the teaching is secondary for them. Now talking about the exit exams and the passing percentage. So the exams for the MDMS is usually done, both the theory and the practical, both are done in their native and in their own colleges only. So the passing percentage for the MDMS is obviously better than the DNB, because in the DNB the practicals they are done in the college which is not your native college, which is other than the native college. So obviously the passing percentage is less in the exit exam of the DNB. Also there is only one exam for MDMS and DNB, which is held at the end of the third year, which we call as a final exam. So where the DNB is considered as an equivalent to the MDMS courses, if you are getting admission or you are doing your DNB from the institutions where there is a minimum 500 or more than 500 bed capacities, so at that institution DNB is considered as an equivalent to the MDMS courses. Do the 1 year of the SRship, and you can teach as a faculty in the medical colleges. Also, if you have done your DNB from the institutions where they are providing the MCI recognized degrees, that is MDMS, in the medical college where MDMS courses are also provided along with the DNB courses. If you have done your DNB from such institutions, then you can do your 1 year of SRship in any of the medical colleges, and you can teach as a faculty in the medical college. Okay. Then the second thing, if you have done your DNB from the college or the hospital where the bed capacity is between 100 to 500, then you have to done one additional year of SRship. So you have to do total 2 year of SRship. Okay. Also, if you have done your DNB from the small hospitals where the bed capacity is less than 100, or if it is a very small hospital, then you have to do additional 2 year of SRship, that is total of the 3 year of SRship, to be equivalent for the MDMS courses. So in case of the first condition, that be with the institution of the minimum 100 or greater than minimum 500 or greater than 500 bed capacity, then your DNB will be considered as an equivalent to MDMS. In case you have to do only 1 year of SRship in order to get eligible for as a teaching faculty in the medical colleges. Also, if you have done your DNB from the institutions where there is a MCI recognized courses which is MDMS, in that case also you have to do only 1 year of SRship, and your DNB is considered as an equivalent to the MDMS. In case of 100 to 500 bed capacity, you have to do one additional year of SRship and total of 2 year of SRship. In case of very small hospital, you have to do 2 additional year of SRship and total of the 3 year of the SRship. Now many people they are asked me many times that if I want to do the DNB, so for which branches I opt for and which branches that are good in DNB. So in DNB, the branches like radiology, dermatology, pediatrics, pathology, ophthalmology and anesthesia, these branches are very good, and even the people who have done DNB from these branches, they are doing their private practices very well. So if you want to do the DNB, in case if you are not getting MDMS, you can opt for any of these branches. So now I'm going to talk about what are the pros and cons in terms of DNB and MDMS. So the DNB and MDMS, they are equivalent in terms of the government jobs which you have work. Also the private practices, it is equivalent to MDMS, or whether if you want to work in the corporate hospital, it is also equivalent. And if you want to apply for the DM or MCH entrance examinations for the super specialty, it is considered as an equivalent for the when it comes to the DNB and MDMS courses. So when the DNB degrees, they are not equivalent to the MDMS. Here the difference is that when it comes to the teaching, that is as a teaching faculty in any of the medical college, that you can say that is assistant professor or etc. So if you do the DNB, then you cannot teach in the medical college. But even after the if you do your MDMS, you have to do the 1 year of SRship in the medical college in order to get or in order to teach in the medical college as a faculty. So these are the terms that I have told to you, that if you do your DNB, you can do the government jobs, you can run your private practices. Even you can work in the corporate hospitals, and you can apply for the DM or MCH entrance examination for the super specialty, except that of the teaching faculty. That is the condition. Also, the commonly asked questions here is, should I take DNB with my choice of a branch, or should I opt for MD in any other branch which I'm getting? So first of all, it's your personal choice. It's a totally your personal choice that if you wanted to do the MDMS or DNB. But my personal opinion on this is that you give preference to your choice of branch, and to the branch which you are interested in, because the branch is going to be there with you for 30 to 40 years, and you have to live with that branch. So if you're working in the branch which you like and which you're interested in, they're more likely to be that you're going to get very, very successful in that branch. And when it comes to the DNB and MDMS, now the DNB and MDMS is considered as almost as an equivalent, and it is equivalent, except the condition that is which are for the teaching faculty. And if you want to teach after doing the DNB, you can teach after doing the 2 years of additional SRship. So it's not like that if you have done DNB, so your practice will not go well. It's totally depend on your professional skills, that how well you can diagnose a patient and you can treat them. It's totally depend on that. It's not depend on the degree, that is the MD, MS or DNB. So I would say just go for it, and all the very best.